Welcome back, everybody. Welcome back to Health Matters with part 2 of our vaccine injured guests tonight. We're just touching on the tip of the iceberg and providing them a platform to tell their stories, and we're glad that you've come back to watch this. Very compelling stories, very heartbreaking stories, and I hope that you find some benefit from this. I'd like to also welcome back Representative Bruce Griffey to help me. He's an excellent co-host, and he can help provide some insight. We did cover a lot of the legal issues on our last episode, and so if you have any questions about that, Bruce provided excellent clarification on some of the legal implications that have happened recently, and you can go back and watch that.
No one has to get a vaccine right now.
Currently,
no one
required.
Has to get it.
No one is required.
Can be required by the feds or your local employer.
That's correct. So that sums it up. So we're temporarily safe. So I would like to welcome our next guest. Again, we are just touching on some injuries that have happened. This obviously isn't the full spectrum, but we have very brave individuals who have wanted to share their story, who have felt isolated, who have felt helpless at times from the medical community and even from the community at large when they've sustained an injury from this vaccine. So I would like to welcome Jim and Tammy Gooch. Jim is going to be Tammy's voice for the most part because part of her injury has left her with a weak voice, so and some memory issues. So he's going to provide us with their story, and I'm going to kind of let them take it where they want it to go, but I would like for you all to kind of lay out just how it started and what you noticed and the sequence of events that brought you to where you are now. I know that Tammy is in the healthcare field, right. And she was asked by a potential employer to get vaccinated, was told that everybody would be required to be vaccinated. So right. That's why she took the vaccine. So I'll let you take it from there.
Yeah, we had our vaccine on the 30th of June. That was a Wednesday. That Friday, we were feeling, somewhat better, from the initial shot. Then about, say, 5 o'clock that evening, she was drinking a bottle of water and she couldn't swallow. I went into her and her lips had swelled up, her tongue had swelled up, and I thought, what's going on? And we was in Cottage Grove. We got some Benadryl, tried to get her to swallow that. She was unable to swallow, period. Took her straight to Henry County.
Was she having other symptoms? Any kind of nausea?
Now that we look back at it, she was kind of disoriented. We gave her some Meclizine we got from Walmart, over the counter. Mm-hmm. Sometimes she has, water in her ears, so, that's our protocol for that. So I was thinking, well, maybe she got some water in her ears from the shower.
And Jim, Tammy is otherwise healthy. She's under 55
Perfectly.
years of age, no serious health issues or anything.
Yeah, perfectly healthy.
Okay.
And we went to the hospital at Paris, and they wanted to tell us that it was a reaction to her blood pressure medicine.
Lisinopril? Is that the?
Yeah, Lisinopril. Mm-hmm. And she had been off of that for a month. She hadn't taken that. I tried to explain to the ER doctor that, she's disoriented, she's not making any sense.
How long had she taken the blood pressure medication before she went off? Had she been on it for how long?
For years.
Yeah. It's
no problems with it, never a reaction.
Were you guys at this point concerned that it was from the vaccine?
When we got there and, you know, the symptoms come up and he wanted to blame it on that, I was like, you know, she had this shot 48 hours ago. And he was adamant about saying, no, you know, it's not the shot.
Did you get the shot, Jim?
I got the Moderna shot, she got the Pfizer.
Okay. Did y'all get them at the same time?
We got our second vaccination at the same time.
Okay.
You know, she you know, was saying she got stung by a bee, but didn't know where she got stung at. She told the doctor that we lived right around the corner from the hospital,
Yeah.
and we lived 15 minutes away.
So she was totally disoriented
Yeah.
at this point.
But, you know, because he said, or because Tammy said her name and birthday, she was able to speak on her own, you know, for herself.
You felt there was something more wrong at that point.
Yeah, I demanded he keep her, and he said, no, I can't, you know, because she was wanting to go home. She was scared to death, you know, so we walked out of the hospital. We went home. She got a bottle of water, took a drink of it, immediately spewed it all over the place. We went to the bedroom and packed a bag and went back to the hospital. From there, they took us straight back into the ER. I met the doctor coming out of another room. He took one look at me, walked the other way. He never saw her the rest of the night. We stayed in the ER room till 7 that morning.
When there was a shift change.
Yeah. Then,
Do you feel that doctor was disregarding your concerns?
I think I'd made him mad because I was, you know, telling him there was something else going on. It was more than what he had, and I think he got offended. And, you know, I mean, it's.
You were being her advocate.
Yeah. I mean, you know, I wasn't going to let him write this off as something that it needed more investigation.
Sure.
So.
Boy, did you turn out to be right, didn't you?
Well, I mean, you know, I've been with her for several years, so I kind of know, you know, what's going on with her.
Right.
But, you know.
Well, knowing what we know now, what happened to Tammy, you know, you were spot on at that time, and you just knew.
Yeah, I mean, you know, and so they had an administrator come down and transfer.
You just sat there in the ER for hours.
Yeah, we sat there. She was on a Benadryl IV, you know, had for the, you know, for all the swelling and stuff. And they said, you know, it'll go right down, you know, it's not a problem. Well, at 7 that morning, we got transferred to Jackson. Of course, when we packed clothes that night, they were in the car. We didn't pack near what we should have packed, but, you know, I had a change of clothes and she had a change of clothes, and I followed the ambulance to Jackson, and we got down there and, you know, she.
It's all right. Just,
Take your time.
Yeah.
You know, she just gradually deteriorated. You know, and
What time did y'all get down to Jackson? You remember?
oh, we were there by by 8 o'clock. 8 o'clock that morning, we were there.
Was her breathing okay during that time?
At that point, yeah, it was okay.
It was the swallowing that was the biggest
The
issue.
swallowing, she absolutely could not swallow anything.
Had the swelling gotten worse?
The swelling stayed pretty much the same for a while.
Lips, tongue?
Yeah, I mean, you know, we've got pictures of, you know,
Yeah.
several days in the hospital, and, you know, lips stayed big. They even got big scabs on them, and then at one point, you know, her mouth turned all white, and then it started sloughing off.
So I don't mean to interrupt you, but we do have some of those pictures, and I mean, this may be a little bit, you know, hard for some people to look at, so I want to give you a little bit of warning, but I think it's really important to see some of this progression. So Jim and Tammy have provided us with some photos kind of some of the progression that Kevin's showing now. And this picture that's up right now, this was kind of initial. Was this at Henry County when you were there, or?
I believe that is at Henry County, yeah.
So this was kind of in the beginning.
Yeah, and that was in Jackson there.
You can start to see some of the scattering.
Some of the blistering, yeah.
Inside.
Yeah, and it was several, over several days, and during that time, her breathing got more shallow. She couldn't lay back in the bed. She had to stay sitting up.
It looks, I mean, it had to be extremely painful.
Nose is
for her.
swollen.
Yeah. I mean, she was in a lot of pain. Like she said, it felt like she was having a heart attack. And that was all that stuff that was sloughing off. All the way down. When she had it rough.
Yeah.
Over a period of probably the better part of 3 weeks.
Wow.
She slowly declined, to the point to where...
Was she at home now?
No, she was still in Jackson Hospital.
Yeah, you can see those pictures are just really...
Couldn't eat any food, I guess, I'm sure.
No, couldn't swallow anything. And they were giving her medication in applesauce, crushing the pills, giving them applesauce for her to take that, and I don't know where it was going, but she wasn't getting it. She went, declined to the point to where she wasn't talking, she was just laying there in bed. And the doctor was doing everything he could to get her to a different hospital. Vanderbilt wouldn't accept her.
Why?
They said that, he had actually diagnosed us with Stevens-Johnson's disease, and they said that wasn't the problem. That wasn't.
They just kind of washed their hands of it.
Yeah,
they didn't want to have anything
to
do.
And he tried. This guy tried everything he could. And so, I met him in the hall, and we had a real strong conversation about getting her somewhere right then. So he had ordered a CT scan. He done that. He said after that she's going to ICU. So she went to ICU in Jackson, and she was there about 30 minutes. The doctor said, we're going to have to intubate her, and we're going to have to send her to St. Thomas in Nashville. And they were going to life flight her, but there was storms in the area, and we ended up having to go by ambulance. So in the meantime, while they preparing all that, I went and got her mother, called her children, and told them what was up. And so I got back to Jackson, and we followed the ambulance to Nashville.
You ended up at St. Thomas.
Ended up at St. Thomas.
Intubated her in Jackson.
Yeah. They said she wasn't stable enough to make the trip, without being intubated.
Did your doctor in Jackson acknowledge that he thought it was a vaccine injury?
At that point, there was rumors that it was, possible vaccine related. They never said, yes it was or no it wasn't, but they didn't know what to do. Right. So we got to the ICU in St. Thomas, and we met all the doctors there, and I mean, they were outstanding. I mean, the level of care was, way above what we were used to. He went through her total med list, diet, I mean, everything. And he ruled all her medication out, all of her foods she was eating, everything was ruled out. He said, this is a vaccine-related injury. He said, I reported it to the CDC. Expect a call from them in the next couple of weeks at the latest.
That was when, in June or July?
That was July the 13th.
Have you received a call?
We are still waiting on that call.
And we talked about this in the other episode that the CDC promised us that they were going to bird dog this VAERS website and make sure that every reported injury was followed up on.
Yeah.
And clearly you have, and we already heard from our other guests what that entailed, which was a bunch of nothing.
Right.
And you've heard nothing, literally.
Nothing. No call. I mean, I answer every call now. I answer spam calls. You know, I've talked to our warranty specialist so many times. But, you know, it's, you know, and after that, you know, they got her into a regular room and, you know, told us to go home and you know, that you know, she could possibly eat some soft foods.
Is she still intubated now, or did the...
No, she was intubated for about, I'd say about 14 days.
Wow.
Wow.
And then after she got off of that, you know, they got it in the room and
Had
Still
the
at St.
swelling
Tom-
gone down, or?
the swelling had started to go down a little bit, and but you know, they said, you know, there's a lot of inflammation. Of course, during that scope, while she was intubated, is when the lining of her esophagus come out.
Tell us about that a little. So she was intubated, and then they did basically where they put a camera in her esophagus.
Right.
So everybody is clear. The intubation is in the trachea.
Mm-hmm.
That's where your oxygen comes and goes from, and then the esophagus is where you eat your food,
Right.
and that it goes down that area.
Right.
And they scoped her esophagus. We're showing pictures now, and I actually read the operative report from this, and there was almost essentially no normal mucosa, which is the lining of your mouth and your esophagus. And there was, when he was coming out with the scope, there was kind of a flap or a movement. And when he did that, the entire lining of the esophagus came out.
Right.
And he noted multiple areas. There was no areas that were bleeding, what they said, but there was nowhere in her mouth or in her, what we call the oral pharynx, that was normal. Mm-hmm. It was all inflamed.
Right.
And basically they sloughed this lining of her esophagus.
You know, the way he described it to us was, I mean, we saw him maybe a few weeks or a month later. We had to go back to the hospital. I mean, I'm jumping ahead because we spent a lot of time at Murray prior to this, you know, prior to being released from St. Thomas. But that doctor came in to our room and was surprised to see us.
That she was still alive? That
she was still here. And he said, you know, he started explaining what happened after that procedure. You know, said she was laying there intubated, and she would kind of cough. And when she would cough, this lining would come out of her mouth a little bit and then suck back in. And he was, you know, freaking out. He went and got the other doctor that was in there during the test, and that doctor come in, and when she coughed, he grabbed it and started pulling on it and pulled it out. But he said it pulled out, you know, just, it was no restriction on it whatsoever.
Right, it was just loose tissue.
Yeah, it was just loose tissue. And, but, you know, like I say, you know, it was after that, you know, we spent a few days in a normal room. You know, she could kind of get down a little bit of applesauce, you know, just minute stuff, you know, I mean, so.
Did she have a feeding tube at this time?
She didn't have a feeding tube at that time. We decided to go to her mom's house in Murray, to stay there, you know, that way, you know, if I went home to work in our shop, you know, somebody would be there.
Yeah, provide care.
Yeah. Well, we was there probably 2 days. She started getting nauseous, and, you know, when she would throw up, she would aspirate. So, you know, we went straight to Murray.
They have her on some medication too. When she left St. Thomas.
Yeah,
while she was
they had her on a little bit. I mean, it wasn't much. You know, basically, you would crush the pills and mix them in some applesauce and, try to give them to her. I mean, it was...
The anti-inflammatories or something, or
It was,
did they tell you?
it was
Remember?
pain medicine and, like a liquid, what they call a swish and swallow. It was like basically, lidocaine and, something else to kind
So
of
not
cope.
really anything treating the problem, just treating her pain.
Right,
really.
right. More concerned with treating pain and, keeping her comfortable than anything
They
else.
ever come up with a diagnosis at St. Thomas
Um,
before they, discharged you, or
no.
to go home?
Not really.
They said, we're not sure, but you
Yeah.
go home and, hope you feel better.
Yeah, I mean, they said, basically go home, let this heal a little bit, and we'll see what we can do with it. And in the meantime, we went to Murray. She stayed basically a month in Murray. During that time, they put a feeding tube in her vein,
Right.
and decided, but because that time, at that time, she'd probably lost 50 pounds.
Wow.
And because she hadn't ate since June, it was probably
Wow.
approaching August by that time. And then they went in and they put a feeding tube into her small intestine. Then
Was that at Murray?
it was in Murray, yeah. And then the feeding tube got wrapped around her intestine, caused a blockage. So she started, throwing up bile, and she aspirated. So they went in, fixed that, but her blockage was still there, and she aspirated again. So at that point, she had to be intubated for the second time. Then they went in and resected that part of her intestine and put the feeding tube in her stomach. And so in the period of about 3 days, she had 3 surgeries. Ended up...
Do you remember any of that, Tammy?
No, she was pretty much out of it by that time, and of course, she was weak, she was weak as water. She was in ICU during that time, and she was on just about everything they could give her.
I'm sure they're giving her steroids, high
Yeah.
dose steroids.
Yeah, and they were giving her
Protonics.
what do they call that stuff?
Rhapsody.
A propofol
Propofol and something else.
to keep her sedated.
Yeah, but she wasn't sleeping. She wasn't asleep.
I was afraid to sleep.
She was afraid.
Yeah. Did you feel the difficulty breathing and that kind of thing? Is that what made you worried about sleeping?
I was gonna die.
Yeah, she felt like if she fell asleep, she wasn't going to wake up. And still to this day, a lot of times she feels like if she falls asleep, she's not waking up.
I'll go to sleep on the couch while he's watching TV, and then when it's time to go to bed, I'll be up all night because I'm afraid.
But she spent a lot of time at Murray, off and on, and then we would get back to her mom's house, and then she'd say, I don't feel right, I feel dehydrated, and then she would start getting nauseous, and we knew by that time.
Once that starts, the game's
Yeah,
over.
yeah, it's more than I can handle. So we take her back.
So how many times from the date she was vaccinated to this point where you're talking about now? I mean, had she been in the hospital?
Oh, she's been in the hospital so many times. I mean, she's probably spent less than 30 days out of the hospital since the 1st of July.
Wow.
Yeah.
Wow.
And you were in Jackson and Henry County and Murray and St. Thomas. I mean,
Yeah, I mean, our last time to Murray, we went to the ER because she was nauseous and throwing up, and, we just knew, it was
Yep.
she was gonna aspirate. Well, they wouldn't let me in the ER. So I went out, sat in the car, and then sitting there, I fell asleep. Well, this doctor walked her out there, and his words to me was, follow up with your doctor on Monday. So we went home the next morning, went to Nashville, to St. Thomas. And, they couldn't believe that Murray sent us home.
Right.
They said she was dehydrated. She was nauseous. She was aspirating. Of course, they gave her what she needed right off the bat. They kept her a week.
Yeah, one of the biggest things too about this whole pandemic is that patients aren't allowed to have somebody with them to be their advocate.
Right.
And I've heard a lot of horror stories about, and I have family members who were in an ER, in an ICU or wherever, and they don't have somebody there saying, you like you did the first time that you went with her. And so I think that's a tragedy that we don't talk about with this whole thing, but your family or your loved ones are your biggest advocate when
Right.
it comes to your health care. And sometimes, like Tammy, she wasn't cognitively always able to make the decisions, and
Right.
she didn't have a voice, and you needed to be there for
Yeah.
her.
That's one thing about St. Thomas is, they've allowed me to be in that whole process. I'm at to step out
Sure.
just for a few minutes, while she's in the waiting room, but I don't have time to walk to the car before we're in the ER.
Right.
And usually we're there 20 minutes and they've got her a room ready.
Right.
They already know, they know us by name up there.
Yeah.
But, one of the times we went up there, the doctor that was treating her met us in the ER. She said, I spent some time looking at the CDC website to find where this was reported, and it's not on there. Said, I've talked to the doctor that submitted it. I know he submitted it. I know the date he submitted it, but it's not on there. It's not there.
Where'd it go?
Yeah. And she explained to me that line of communication between the doctors, nationwide, that chain is broken when that's happened.
Oh, yeah.
And, they said there may be somebody, 30 minutes, an hour, or across the country that has the same problem. It's been treated successfully, but we don't know that.
Yeah, and I don't know if you've ever gone on the website yourself, but I found it extremely difficult to navigate.
Yeah.
And I kind of knew what I was looking for
Yeah.
before this vaccine. Honestly, I'd never gone on the VAERS website or had any reason to necessarily go on the CDC website. But it is confusing, and it's hard to find specific details. I think that's
Right.
intentional. I think it's also a little challenging even just to report it,
Right.
to get the report in there. So, that's concerning. Again, like I said, we should be bird dogging every single one of these injuries and figuring out what the causation is.
Right.
You're lucky that you had some doctors that actually put some, not that it changes anything.
Right.
But-
The doctor that's treating her now for her esophagus, that's doing the stretching, she has to be stretched weekly. They start off with, they say like a size 12 or maybe a size 15, and they said normal is 60. And they have to start off with a pediatric scope. And they have to find out, where that opening is to get that in there, and then they can do the procedure.
Right.
But it's a weekly thing to where, they're basically, tearing all that scar tissue,
And then it makes more scar.
all the way down to open her up, just for that to build back up over a matter of days, and then
So I can breathe.
it's back again, you know.
When was the last time you ate anything? June.
Yeah.
And she just had this procedure done, right? Like recently?
Yeah, we got home
Wednesday.
Wednesday. Yeah, that's right. And the doctor, he come out when we was in the recovery and talked to us, and he said, look, he said, this stretching, it's not working. It's temporary, it's not working. You know, I actually tore her esophagus during this test. Said, she don't need to drink anything for 3 days. So, I mean, this is the first day that she could, actually try to drink something.
Can they do esophagus replacements, repair?
I mean, that's definitely out of my ballpark, but I've never heard of that.
Well,
I haven't either. I just,
yeah, they at Murray, they said, we can just take your esophagus out and we'll just stretch your stomach up to your neck and then you'll be good. And we told them that at St. Thomas, and they were like, no, you just can't do that. At the
that scares the
Yeah.
bejesus out of
Yeah.
me.
Doesn't
One
sound-
saying you could do it, and others are saying no, you can't.
Yeah.
I mean, that's scary.
yeah, and they said
Wow.
worst case scenario, you can take part of your colon and stick in there.
Right.
He said,
Yeah,
he said, but even that, that's last resort type stuff.
Wow.
Yeah.
They said as long as you have an esophagus in there, they need to work with what they got. But, so what the doctor's saying doing now is basically he's going to start with a laser and start cutting some of that scar tissue out of there.
Just slowly over time doing it.
Yeah, but she's got he called it like a big buildup right there at the start of her esophagus at her throat, and this guy does the esophagus. He hasn't found anybody, ear, nose, and throat doctor that he has faith in to do it.
Higher up, like towards your
Right.
mouth.
Yeah, toward the throat. He said, but if I can't find anybody, he said, I'll do it.
Yeah.
It's not my wheelhouse, but she needs it, and she needs it right away.
Right. And normal esophagus kind of will contract to move the food that you've eaten down. And so I just imagine that her esophagus now is so scarred that none of that is happening. It's kind of like going from a soft tube to a harder,
Right.
tube. So that normal process is not going to occur.
Right. And her esophagus is like, it's like a scar. I mean, it's basically, it's all scar, and it's hard. He said that it should be soft,
Right.
and it's hard as a rock. He said he has to force the cone in there to actually get the size he wants.
So what has he given you any kind of prognosis as far as and in that part of that question too, is this like a continuing process, or is this just the sequela of the original injury? Meaning, like, do you still get new blisters in your mouth? Do you is it something that
We have noticed, some reoccurring blisters. We don't know if that's from all the procedures she's going through, because she has to be intubated every time she has a procedure. So every week, she gets intubated for a short period of time. Or it's the reaction.
right?
We can't put a finger on it, but we have faith in our doctor.
Right.
He's supposed to be one of the best.
Right,
But-
but he doesn't know what to do in a sense.
Right.
He knows how to handle the problems, but he can't tell you much as far as
Right.
long term because you don't know. We're in uncharted territory right now.
You know, and you know, in medical terms, when he comes out there, you know, he's top of the line. But when you look at him and you're talking to him, in his eyes, you see you see all that worry,
Right.
and you know, it's hard. It's hard to see that.
Right.
You know, we've had nurses come in, sit down and talk to us. And in case, you know, we know most of them up there now.
Right.
You know, the front desk people know us.
Right.
But, you know, I mean, they come in and sit down and talk to us, and, you know, they start crying.
Yeah. We're all humans. You
Yeah.
know?
Yeah.
And I mean, that's why I think it is important to make a human connection to these problems rather than just saying we've had almost 1 million people injured.
Right.
That you know, people by nature are compassionate, and that's why I think it's really important that you're here, and I really appreciate you.
Put a face with the
Right.
story.
I know, you know, we're talking about all the physical issues that Tammy's had to endure, you know, but this doesn't just affect her, obviously. You know, you're not able to work the way that you want to work. She
Right.
obviously can't work.
Right.
Can't
And-
be left alone.
Right,
Yeah.
right. So, I mean, this impacts you not just physically, but obviously emotionally and financially. And I had, just like our last guest, I had you kind of get a rough idea of what her medical bills are, which probably doesn't count her last hospitalization.
Probably her last 3 hospitalizations are not
And what are your bills looking like at this point?
close to 650,000.
Wow.
Yeah. So she's going to be, you know, like our other guests, probably over $1 million at some point.
Yeah. Yeah. I mean, you know, everybody at St. Thomas is really working with us. I mean, we stayed a week and a half. They gave us a $60,000 discount.
Yeah.
You know, I mean, it would have been $100,000. But, you know, and
You know what aggravates me is why isn't China being responsible for all the damages and injuries caused because that virus got out from
Yeah.
over there. So, and I don't hear any of our politicians
Or-
at the
or
federal
like I
level
said before-
bringing any of those issues
Right.
up.
You know, their medical bill to Pfizer or Moderna, whoever her vaccine was from, would be a drop in the bucket to them.
Oh, absolutely.
I mean, they're making $42 million or $1 billion a quarter.
$4 billion a quarter.
Yeah.
So,
you know,
Yeah.
and you know, the thing is, you know, we're just regular people. You
Right.
know, we're scratching out a living, and now bills that we normally paid without question is now a luxury to us. You know, I keep the lights on, the heat on, and our phones. Those are the 3 things we have to have. Other things are a luxury. You don't have car insurance. You don't have house insurance. You know, I keep gas in the tank enough to get to Nashville and back, and enough food for me to eat. You know, and that's it. You know,
Wow.
everything else is a luxury at that point.
and everything, all the prices are rising, gas
Yeah.
prices,
Yeah.
food prices, everything are going up. And that hurts, you know, working people more than
I
anybody.
can't
Yeah.
get my medications.
Yeah, I mean, you know, we look at the medications and say, you know, what's this going to cost? And then we go from there and say, okay, well, she's going to need this, she's going to need this stuff here can wait. You know, and it's just one of those things we have to do.
Right.
You know, I mean,
Well, I mean, I know Mike and I kind of talked about this before, but we would, if, you know, people want to help you out, if you're okay with that, I mean, we can find a way to, there's a lot of generous people in this area.
yeah. I mean, and
And-
we've found that out. You know, I mean, there's there's been people that have been really gracious, and you know, with family, you know, family and friends. I mean, and you know, people that you know, you didn't think was your friend.
Right.
Yeah, neighbors.
You know, so what we'll do, you know, is we'll put it on the Facebook page or add it, you know, to the show, a way that people can help you out. You know, it's what we do for each other.
Well, like
And
I say, you know,
you know, you're not some pie in the sky person. You're our neighbor. You're, you know, and this isn't just happening in big cities or faraway places. This is like real life people. And you two are.
yeah, I mean, you know, I'm fortunate enough to have a shop that's right next to the house. You know, and I can walk out there and work on a few things and go right back in and check on her, and go out there and work for a little bit longer and go back in and check on her. But, you know, my medical attention to her doesn't stop. You know, it's 24 hours a day. Yeah.
Yeah.
Yeah, you know, so I wash my hands, go inside, take care of her, come back out, and
Had to learn how to use a feeding tube.
yeah. I mean, I've gotten pretty good with that feeding tube. I mean, I even show the nurses a few tricks. You know, one of the things I did when she was in the hospital is I paid very close attention to everybody's little trick, you know, and I've gotten pretty proficient at it. But, you know, it's not something I want to do.
Right.
You know, I don't want to see her with a tube sticking out of her stomach. You know, I don't want to see her carrying around her little tripod with her food on it.
And she wants to be a nurse again, right?
Right. I mean, she
Taking
took
care of other people.
right. I mean, she took care of me. That's what brought her here. Is I was hurt. You know, so I mean, she relocated from California.
Wow.
What do you got? We talked about this with our other guests too. Like, what do you want people to know? What do you know, you have the mic right now. Like, what's your message? What?
Well, you know, I think everybody should have a choice of what they want to do with their body. But, you know, I had seen enough information out there that I really wasn't going to get the shot. You know, Tammy had just had gotten the first shot in January, and she, you know, she wanted to get a job local, you know, because the place she was working at was in Murray. It was too far for her to drive. She couldn't see it at night, so I was having to take her back and forth to work, which was a big inconvenience. I said, you know, why don't you get a job in Paris? And so, you know, she went to 2 interviews, and they said, you know, you have to be fully vaccinated. So she went up there. Of course, she had talked me into getting my first shot, and I told her, you know, 2 or 3 weeks later, I was like, okay, I'm done with the shot. You know, 1 shot's enough for me. I think I'm good. You know, I made it through that one. And so she said, well, I got to be fully vaccinated before I can go to work. And I said, well, that's, you know, it's up to you. So
She never got to work.
yeah, that's right. I mean, you know, that was a Wednesday she got the shot, and
2 days later.
2 days later,
In the
you know,
emergency room.
yeah, our whole life was turned upside down.
And hasn't changed since then either.
No, I mean, we don't even know where the end is. I mean, that's you know, the reality of it is we don't know where it's going to end. We don't know how it's going to end up. I mean, it's too much to think about.
We don't get to see family or friends.
Yeah.
I'm isolated.
Yeah, she can't get out and do anything. You know, we got a window of about 2.5 hours to go and do anything. You know, because she's got to get back, and she can't move around a lot because of that tube, and you know, she's got pain from basically her throat to her stomach, and you know, and I don't want her to get nauseous. And we keep a bag packed by the door, and I keep enough gas in the car to go to Nashville, you know, and that's our life.
Wow. I mean, I thank you guys so much for sharing this. I know it's incredibly hard.
We're praying for you.
Yeah, you'll have a lot of people praying for you after
Absolutely.
this.
Yeah, I mean, we're thankful for everything, but it's just been one hell of a journey. I mean,
Can't imagine.
Maybe our politicians in Washington D.C. will wake up and smell the coffee
Well,
and do something.
I
Get off the stick and do something.
Yeah.
I mean, this is just unconscionable in my opinion.
I agree.
yeah, I mean, I one night we were in Nashville. I emailed Marsha Blackburn. Immediately got a response back. So I wrote back and told her that I was thankful that she answered my email, and I sent it, and I got a response back that said, "This was a robot. You can't respond to it."
Right.
Yeah,
So-
there's
I was gonna say it was a.
acknowledgement email.
Yeah.
Yeah. And look, I don't want to inject politics in your situation, but it matters who governs and who's got enough votes to make something happen up there. And so 2022 is going to be critical.
We talked about that the last show. I mean, the midterm elections are going to be really important, and we talked about protecting our military from this mandate too, and it matters. Your vote, it should matter, and we need to make our opinions heard by our votes.
Yeah.
So.
And they're trying to push the vaccine on kids 5 years older,
Right,
5 to
imagine
12.
what it's done to your body,
Well-
to a 5-year-old,
We got severely scolded by our kids for taking the vaccine. I mean,
It's usually, I hear a lot the
Yeah.
other way around,
Yeah,
actually.
it was actually the opposite. We didn't get to scold anybody. We got scolded. And, I felt like a little kid after that, But,
Thank
Well,
God it was me instead of the kids.
well,
Man,
I wished it was me instead of you. I mean, that you shouldn't have to go through this.
Nobody should, really.
Nobody should have to be that unlucky person that has
No.
a bad outcome. And if there
Right.
is a bad outcome, the drug companies and the government and China
Should
ought
be
to be
responsible.
responsible, absolutely, for you guys suffering and your economic losses.
I'm telling you that any other drug in history had this bad a track record, it would have been gone within months.
Right.
I don't understand.
Every time I see Biden say, take the vaccine, it's safe and effective, it makes me want to Elvis the TV.
I know.
I mean,
I'm with you.
It's nonsense. It's neither safe or effective.
Right.
Yeah.
And again, we touched on that before. It's clearly not safe when you have tens of thousands of deaths and 1 million injuries, and it's not effective when your efficacy drops to below 50% and even as low as 13%.
Right.
It's not. And so
For a
but
virus with a 99% survival
right,
rate.
and our own hospital just put out a social media post, safe and effective. It's safe, yes, and if you've already had COVID, you still need to get it. I disagree with that.
The Tennessee Department of Health is saying, "Oh, now your children can get vaccinated. Bring them
Yeah.
on in,
Yeah,
or
bring 'em
whatever."
in.
For kids, I think that's
And there was
malpractice.
right, and there was the shaming of, well, you're doing this for your community, but clearly you're not doing anything for anybody because you can still give it to them.
Right.
So, you get vaccinated, oh, good, you can go see grandma in the nursing home, but yeah, you just brought her COVID.
Right.
It doesn't make any sense, and the language is so opposite of what's actually happening, and I think
Right.
people are starting to realize that, and y'all telling your story, I mean, I think that it's coming, it's hopefully that people are starting to see inconsistencies in the verbiage versus reality.
Yeah.
Well, and if more people have suffered injuries will, come forward.
Right.
And
come
who knows what
come
the
on
next
Heather's-
10 years are going to bring us.
Exactly, exactly. Come on Heather's show, tell a story.
Yeah, come on here.
One of our nurses had been there for 30 years and she lost her job.
Yeah. Yeah. They said that 78
Employees.
doctors and nurses lost their job on November 12th at St. Thomas.
And I think that should raise some questions in the community of why so many healthcare workers who've been on the front lines are refusing this
Right.
vaccine.
Right.
You know, it's something to think about. But I can't really thank you guys enough for being here, and you spent a lot of time here, even more than you've been on camera, which people don't know. But Mike and I both really felt it was important to give you a platform and to give you a voice, and we're going to figure out a way to help you. Okay?
We appreciate you having us on. You know, I think the power is in the people, and the people need to,
Agree.
Agree.
they need to stand up, you know, and say, hey,
Enough is enough.
yeah,
We don't want this to happen.
we're
to
done,
anybody.
you know?
Right. I don't want anybody to go what you go
And you have the choice.
Right,
Yeah.
right. Well, thank you very much. Appreciate your time, and you know, if there's anything else that comes up in the future and you want a place, we're here.
We'll keep you updated, and you just
We
let us
appreciate
know if
that,
you
and
want us back.
I know that people will be interested in reaching out to you too, and finding out what's happened with you,
Yeah.
and hopefully you're healing and recovery and return to, you know, normal life to some degree,
Yeah.
right?
I'm not gonna stop until she's 100%.
Okay,
all you can do.
You're lucky
Keep
to have
going.
each other.
And like I say, you know, it's not her fault. She keeps saying she's sorry she's putting me through this, you know, and it's not her place to say sorry.
Right.
I mean, you know, she has nothing to be sorry for. She was doing what was right. She took that job so we could have health care insurance. That's the reason why she
And
took that
listening
job.
to the media and the CDC and the FDA and everybody.
And the
and the president, without being fully warned of
Fauci.
all the downsides and
Right.
I'm sure y'all just signed a paper too, so you probably did not get a full informed consent, which is.
I don't even know if I signed anything,
I saw it.
to tell you the truth. But like I say, you know,
Well, keep going, hang in there.
Yeah, hang in there, and we look forward to hearing about your successful
you.
recovery, okay?
Thank you.
All right.
Take care. God bless.
Yeah, thank you.
all right.
All right, we're going to take a little break now, and we'll be right back. Welcome back, everybody, to Health Matters. This is part 2 of our series on vaccine-injured victims. We just finished a really interesting conversation, an emotional conversation with Jim and Tammy Gooch, welcoming back Representative Bruce Griffey to help me co-host. He's excellent co-host.
Oh, thank you, Heather.
And we have a new guest here with us. And again, we're just providing her a platform to tell her story, to tell what has happened to her since she was vaccinated, maybe when other people wouldn't listen. And this is another healthcare worker, surprisingly. I didn't do that on purpose, but it seems to happen. But this is Evelyn Merrill, and we'd like to welcome you here.
Thank you.
We're glad to have you, and what the watching audience doesn't know is you have been here for a long time tonight, but we want to give you as much time as you need to tell what's happened to you since you were vaccinated. Let's start. I've asked everybody, were you forced to be vaccinated, or was this a choice that you made?
I was not necessarily forced. I made the choice knowing that somewhere down the line it was going to be required in order to work.
Okay.
And I knew I had to work, so
What do you do?
I'm a registered nurse. I work here locally in Paris.
Okay. Were you healthy prior to being vaccinated?
Other than high blood pressure, yes.
Okay. So, when did you receive the vaccine?
I received my first Moderna vaccine, it was around January 5th of this year.
Okay.
And then
When you took that vaccine, were you given informed consent?
I signed a paper. I didn't.
It seems to be a recurring thing.
I guess I wanted to have faith, and we were being told the truth of everything.
You had no worries, though. You felt okay doing it.
I had some reservations, but I mean, like I said, I knew I had to work, and so I just.
You figure it's coming down the line anyway, might as well do it now.
Yes, sir.
And,
Yes, sir, exactly.
Yeah, understand.
So, did you have any adverse effects after the first vaccine?
Yes, ma'am.
What happened to you?
That the same night that I had it, I started having like flu-like symptoms, severe chills, headache, body aches, fatigue, and sore throat, that type of thing. The next morning when I got up, and this sounds crazy, but I've heard some other people that also had this same thing, I had a toenail actually fall off.
Just fell off.
It just fell off.
It wasn't bruised or
It
anything?
wasn't nothing, no. Which I thought, well, it's just coincidental type thing. I had a lot of edema in my lower extremities. That I was off work about a week that time, in bed pretty much for the whole week. Started feeling some better, and of course then 3 weeks later, the month was up. I got my second vaccine. Same symptoms recurred: the sore throat, the chills, headache, body aches, legs swelled back up again.
And you lost another
And
toenail.
I lost another toenail.
Wow.
I've lost a total of 3 toenails when I got that. So that was
You ever lost a toenail before this?
No, sir. No, sir. So that would have been the first part of February. By April,
Let me back up just a little bit.
Okay.
When you had these symptoms, because a lot of people, I didn't get the vaccine, but a lot of people said, it makes you feel horrible.
oh, it did.
And were you concerned at this point that this might be something that was more long-lasting?
I was. I was, and I kept kicking myself for going ahead and getting it.
Yeah, I've had people get one shot and say they're not getting the other, and even ask me, "Is there any way to get it out of my body?" And unfortunately, there's not a way.
Oh, I've been eating vitamins and any kind of home remedy I thought might help. I've been doing for this past year.
So take us back to after your second vaccine. Were you sick for another week again? Mm-hmm. You went back to work?
I went back to work, and it has been almost like a cycle where I'll feel good, pretty good for about a week, and then it starts again: chills, sore throat, body aches.
How about the leg swelling? Are you still
My legs? Oh, my legs stay swollen now all the time.
Did you ever go get a COVID test?
I had multiple COVID tests because every time I've got a chronic cough now that I've had since April, and it will not go away. And
So every time you go to the hospital, they just say, "Oh, you probably have COVID," and test you.
they
Did you ever
Yes.
Did you ever get a positive COVID
No,
test?
sir.
They're all negative.
they're all negatives. The first trip to the hospital in April, they diagnosed me with bronchitis, which I had never had in my entire life. In August, I was back at the emergency room. They, of course, swabbed me. In August, I actually got swabbed about 4 times because I had made so many visits to the urgent cares and that. And that every time I went, they would swab me for strep, they would swab me for COVID and flu. They always came back negative.
So what did they tell you?
The first time I had bronchitis. The second trip to the ER, they said it was just some kind of viral something and just have to let it run its course. The last time I went it was either the end of September or the first part of October, and they just told me I need to follow up with my primary care and probably see a cardiologist.
Has anybody have you brought up, or has anybody said that this could be related to the vaccine?
No, the couple of times I tried to bring up the fact that all these symptoms started after the vaccine. One time I was told I didn't need to be spreading those types of rumors. And the other time was, you just need to get a booster shot because it's been 6 months.
So you've had nothing but problems after your first 2 shots, and the solution is to have a booster.
And so why did they refer you to your cardiologist? Was there some test that indicated there's something going on?
Well, because of the chronic cough and chest pain, because when I went in October, or into September, October, I actually thought I was having an MI.
Yeah,
Because,
that's
I mean,
a heart attack.
And I mean, I have constant chest pain anymore,
You still have that all the time?
all the time. It's-
And your heart checked out normal?
The EKG was normal. The cardiac enzymes were normal.
How many times do
They do
you...
an echocardiogram,
No, sir.
and that's the one that would show whether there's any myocarditis, wouldn't it?
Right.
But they didn't do that.
No, sir.
How many times do you think you've been to an urgent care, ER, physician since you were vaccinated in January?
3 times to the ER and probably 6 to 8 times to urgent care somewhere.
Before you were vaccinated, how often in a year do you think you went to the emergency room or to an urgent care?
To the emergency room, none.
Yeah.
To my primary care, I would go like twice a year or so just to
Yeah, for
for
checkups.
checkups. Mm-hmm.
And no urgent care or anything like
No,
that?
ma'am. No.
A lot of people have messaged me with similar symptoms like you have. Also, like brain fog, decreased energy, short of breath, joint pain. Do you have any of those symptoms?
All the above, and that's one of the things that worries me because people count on me to be at the top of my game and my mind being alert and that. And there's some days I can't even work a simple math problem.
Yeah.
I have to. I mean, and I'm pretty good at math. I'm not
Yeah.
gonna say I'm a math genius, but I'm pretty good at math. And there's some days I can't focus enough to.
So it's affected your work as well?
Hmm.
You're still working, though.
I am still working. I was working another, like a part-time job at the school system, and I ended up losing it because I kept having to miss work.
Are you under 60 years of age or older 60 years of age?
I'm 56.
Okay.
Do family members notice a change in you?
My husband does, yes.
Yeah. What do you think? What would he think is the biggest change? Just your overall well-being?
Yeah, because, I mean, I don't have the I'm usually pretty active, and then I don't have the energy. I go to work and I come home. I'm up a lot at night because I'm coughing so much that I have trouble sleeping.
And they've
Yeah,
never found
because-
out a reason why you have this cough constantly?
No, ma'am. And I've got, constantly have the back of my throat is sores in my mouth. Pretty
Really?
much constant.
We had another guest, as you saw,
Mm-hmm.
with a lot of severe problems,
Severe,
same type of thing. I think, you were mentioning that, compared to some of our other guests, your symptoms weren't as severe. But I think what's important to understand is the spectrum of these problems that people are experiencing after the vaccine. And that just because you're still able to work and you're still living your life, that it's still life altering. And it may be in a more mild way than some of our other guests, but it still has affected you in an adverse way. And so that's one of the reasons I thought it was really important that you tell your story. Plus, I think you wanted to tell your story.
I did.
Yeah.
Because I think people need to at least have a choice as to whether or not they want to.
Every single
know,
guest has said that.
Yeah.
Evelyn, did you report your adverse reactions on the VAERS system?
I
you
did
go
not.
on that?
I
Have
did
you
not.
followed up with the physician or where you got the vaccine to let them know that you
No,
had-
sir.
Okay. You gonna do that after maybe?
To be honest, I didn't see that it would do any good to report it.
And Heather, that's what kind of concerns me about with the vaccine too, is there's probably a lot of people like Evelyn that aren't reporting adverse reactions, so those never even show up on the VAERS
Right. I think
database.
these more mild type chronic symptoms are way underreported. The VAERS system acknowledges that it probably only captures 1 to 4% of actual injuries, but I think this group that Evelyn's in is massive.
That's what I think
We would be well over 1 million injuries if all those were reporting. But most of these people go to their physician and tell them their symptoms, and they will not acknowledge that this is a vaccine injury. But I know many, many people, I think that's probably one of the biggest complaints is the fatigue and the brain fog, besides joint pain. And that's actually what I've seen is a lot of joint pain because I'm an orthopedic surgeon. But, most physicians are going to not give you any credence to your complaint, but you can report it on the VAERS system
Right.
as well.
Yeah, I knew I could, but I just figured it would fall by the wayside, then I guess that's why I didn't.
Yeah.
But
You're
even-
probably right, it
But
probably
even
would
like,
fall by the way.
I mean,
even
it's
like
sad,
my
but it-
arm, like where, that I was injected in, and this was January and February, there's still a spot there that I can't stand to have touch because it is still so sore.
Yeah. Yeah, I mean, it's a full spectrum, and like I've said throughout our show, this is just the tip of the iceberg, and I think that more, you being on this show as somebody who's had more mild symptoms may be really waking up a lot of people who've experienced similar things that you have and not really understood why. Maybe not correlated it even to the vaccine, or have thought it was a vaccine but had a doctor tell them it's not.
It wasn't.
And
And even at work, I've seen changes in, because some of the patients, I see them quite often, and I've seen changes in them since they got the vaccine, but there would be no convincing them probably
right.
that might be what it is, but deep down I know.
Right.
I'm pretty sure,
Right. I think too that a lot of people acknowledging something like that would also be acknowledging that they put something really deadly in their potentially deadly in their body, and or they encourage family members to do it, and that is not something anybody really wants to think about. Everybody thinks they're doing it for the right reason, and I think most people had that intention. I'm doing it for my community, I'm doing it for my family, I'm doing it for my immune compromised child, whatever it may be. But the reality isn't really panning out that you're doing anything for anybody except for Pfizer, Moderna, and Johnson & Johnson.
I'm thankful I don't work in a pediatric clinic where I have to feel like I have to inject a child, because
Yeah.
I would definitely have to walk out the door.
And your husband is not vaccinated.
He is not.
How about other family members?
It's probably 50-50.
Right.
I kind of got into it over the weekend with my older sister, because her take is, we're never going to get over all this till everybody gets vaccinated. And I'm like, well, I beg to
Yeah.
differ. And
Yeah.
I told my husband, I said, she doesn't realize how sick I've been for this past year.
Right. And what else people don't realize is this is never going away.
Yeah, we're never going to get over
I mean,
any of it.
it's
No.
here
Ever.
forever,
That's right.
and it's going to continue to mutate, and just like the flu,
Right.
it's going to continue to mutate. And we have a leaky vaccine. This vaccine does not kill the virus. It's not a polio vaccine. Like, I've had people say to me, well, you took the polio vaccine. And I said, well, yeah, that was researched for like 40 years before it went on the market. And once you get the polio vaccine, you're not going to get polio. What we found is that you get the COVID vaccine, chances are you're probably going to get COVID.
And
So-
I mean, my mother, when I was little, didn't believe, I think by the time I come along, she was so much older, she just kind of was tired. She didn't get me vaccinated when I was a kid. So I had every childhood disease possible.
Yeah.
And so I was always usually an advocate on getting vaccines.
Uh-huh.
After this, not so much.
Yeah, I understand. So, do you feel like, I mean, obviously your quality of life has really been disrupted. Do you feel like your symptoms are getting worse, staying the same? Like, has there been a change at all?
I know for sure the coughing is worse. I've been keeping my fingers crossed that I didn't go into one of my coughing fits while we were here. And the fatigue is, I mean, I probably miss a week of work every month because I can make it from the couch to the bathroom and back to the couch.
How long do your coughing fits last?
It might be 3 to 5 minutes.
Wow.
I mean, you know, and it's several times a day.
Wow.
As far as your work, I mean, have they expressed any concern about you missing work
They've
and
actually
coughing?
been good, really good about it, because they've seen the progress. You know, they've seen how I've progressed as far as feeling bad over these last 11 months.
So no booster for you.
No booster for me. No.
What, like I asked everybody else this too, but like, first of all, I want to make sure that you've said everything you want to say, but I also want you to tell people what your message is to them and what they should take away from your story.
I think don't feel like you have like you're being backed into a corner and having to do something that you don't feel comfortable doing. And if you have any kind of reservations, listen to your gut instinct. Because, I got the first one, and after I got so sick, I said, I'm not getting the second one. And then time came, they called me and said, you're due for your second one. I was like, okay. And I thought, okay, I'll just go ahead, and then I thought, well, if there's a long line out there, I'm not gonna wait. Well, I get out there and there's not a car on the parking lot, and I'm like, oh crap, so, and everything. But if
I know
I
one other
wish
thing
I had listened to my gut, because if I had, I wouldn't
You
have.
wouldn't have done it.
Wouldn't have done it.
You told me on the phone that you also get rashes all over your body too.
Well, it's
And never had that
I never
before.
had it before, and most of the time it's just on this one side, and it usually from about the mid neck down to right about here.
So I kind of noticed you're getting
So-
yeah.
And
Itchy, or is it
it doesn't itch. And usually it'll be very prominent right before I get the chills and the sore throat and everything. I've got places like my hair I've lost a lot of hair, and I've got places on my scalp. There's no sores, visible sores, but I've got places on my scalp that I can't stand for anybody, even the hairbrush, to touch it.
Yeah. I mean, it's just, there's a lot of these very bizarre constellations of symptoms that I have people reporting. And, it doesn't make any sense or doesn't fit into a diagnosis. And I think that's why a lot of doctors are scratching their head. But when I listen to you tell me all these symptoms that you have, it really doesn't fit into something like, oh, here, you have this, take A, B, C, and D,
No.
and you'll be better. And I think that's why there's this feeling of isolation and somewhat of a hopelessness, because nobody can
And sometimes
help
I
you.
feel like they're like, is it all in my head, type thing,
Well, people
sometimes-
probably make you feel that way.
Yeah. Yeah.
Yeah. Well, I don't think it's all in your head.
No. I know how I feel. It's definitely,
Yeah. I mean, even some of the people I know who've had severe injuries have been accused of faking it or
Yeah.
exaggerating their symptoms. And it's just, that's not how we treat people or treat patients. So, but I really, really appreciate you coming on.
well, I appreciate you having me.
And I hope that you have a full recovery from this as well.
Absolutely.
And
Both praying for that.
people
Yeah.
will be praying for you.
Well, I have faith that we will, so.
Yeah, so keep us informed,
No.
because like I said with my other guests, I have a feeling that the people watching the show are going to want to know what happened.
Yeah.
So-
Well, like I said, almost felt guilty for hearing their stories and, compared to what mine is. And I'm like, okay, I'm really lucky.
I would, I wouldn't say you're lucky, but I mean, your story is really important though. I want you to understand that, because your story is probably more common than any of these other stories. And like I said, it may open some eyes, even in the medical community, that we shouldn't just be disregarding people with these complaints like you're having. So yours may not be as severe and as life-altering, but it has affected your life, which makes it a problem, number one. And your story is important for a lot of people who might be watching this show. So I appreciate you.
Yeah.
And like I said, just keep us informed and let us know how you do. And you got me on Facebook, so
Okay.
you know how to get a hold of me.
Yeah.
But we appreciate your
Okay,
time.
well, I appreciate you listening to me, and I hope it'll help some other people that,
I'm sure you will.
I'm afraid, that don't want to say anything.
Sometimes just hearing your story gives them strength to stand by their convictions.
That's right.
Yeah,
Right.
so, okay.
You never know who you're going to reach, right?
That's right.
That's right.
Thank you, Evelyn.
All right, well, thank
Thank
you,
you,
Mr.
Evelyn.
Griffey. Thank you, Heather.
All right. Well, I'd like to thank Bruce again.
Thank
It's
you.
been
Thank you,
really
Heather.
wonderful having you here and
Thanks for
guiding
having
me
me.
through my first show. First 2 shows, I guess, technically. I want to thank Mike for introducing me to this media. New thing for an orthopedic surgeon, but I really appreciate it. And I, of course, like to thank our viewers for tuning and watching, and of course to all our victims who showed up here tonight. Please make sure you join us January 11th for the first official show of Health Matters. Like I said, hopefully it'll take off and it'll be a real benefit to the community. And I look forward to seeing you on our next show.
And Heather, if they'll look on Facebook, keep up with the show. If someone wants to help some of our victims, I think there's going to be a way to do that. So thank you,
Yeah,
Mike,
we'll make
for-
sure, reach out to the Mike Weatherford Show, or to Mike or I through Facebook. That's fine. But we want to help these people, and not just by giving them a voice, but it sounds like they need a little bit more than that. So
And let
just
your
listen.
elected representatives in Congress know how you feel about the China virus and, what it's done to our country.
Right.
And, squeaky wheel gets the grease.
That's
in
right.
Politics,
We need to be
so-
the squeaky wheel a little
Absolutely.
bit more. So,
Absolutely. Thank you.
all right. Well, thank you. And join us next time and for Health Matters, January 11th.